I'm Dr. Greg Hoeksema, the Medical Director of the Cayman Islands Hospital and the Health Services Authority here in the Cayman Islands. And I'd like to share with you some important information about the H1N1 flu virus, which has previously been referred to as the swine flu. Most importantly is for you to understand how you can help us to protect the Cayman Islands from the spread of this virus. This virus is spread from person to person through tiny wet droplets called respiratory droplets that come into the air when you cough or sneeze. And so it's important for you, if you have to cough or sneeze, to cover your mouth, not with your hand, but preferably with a disposable tissue. If that's not available, you can cough or sneeze into your elbow. First, what you would want to do is, if you have to cough or sneeze, go get a disposable tissue, place it over your mouth, and then cough or sneeze. Immediately dispose of the tissue in the nearest trash receptacle. Then, please wash your hands thoroughly, either with hand sanitizer as I'm using, or with simple soap and water at home. You want to do this thoroughly, getting in between all of your fingers and the backs of your hand for a period of about 15 to 20 seconds, or the time it takes you to sing happy birthday to yourself a couple times. Kids, it's simple. You can help your parents remember. Catch them, trash them, wash them. Catch the viral particles, throw them away in the trash, and then wash your hands. In this way, you can help us protect the Cayman Islands from the threat of the H1N1 virus.
The Public Health Department and the Health Service Authority has established a flu response team that meets daily to look at the local developments of the H1N1. We remain committed and vigilant to ensure that we identify and isolate any H1N1 that should enter into the island. This is a national response, and we are working with key stakeholders throughout the community, both in the public and the private sector, to ensure that the approach is consistent in the management of the H1N1 flu.
As part of the aggressive actions that we're taking to protect the Cayman Islands from the effects of the H1N1 flu, public education and understanding by our patients is one of the most important things. The personal actions that you will take and the personal responsibility to help protect the Cayman Islands are a very important part of our first line of defense. It's important for you all to understand whether or not you might have this H1N1 flu. And there's really two very important things when we determine whether or not you might be a suspect case for the H1N1 flu. First and most importantly, you have to have a fever associated with a respiratory type illness, like a cold symptoms like runny nose, sore throat, cough, perhaps body aches and pains. And in this particular H1N1 flu virus, it's also been associated with stomach symptoms like nausea, vomiting, and diarrhea. In addition to that fever with an upper respiratory illness like a cold, you have to have some known exposure, either through direct contact with a confirmed case of swine flu or H1N1 flu, or travel to one of the areas of the world where there have been confirmed cases of the H1N1 flu virus. Our message to the public is this is not a serious virus in the overwhelming majority of patients. So if you feel ill, please stay home from work, keep your children home from school, and certainly if you're concerned about the severity of illness, then go ahead and seek medical care through your regular doctor. You can come to the A&E or visit our doctors at one of the district health centers. One of the questions that comes up frequently are what are the other things that you might do? For example, the consideration of wearing a mask. Now, we know very clearly that masks are an effective way to prevent a person who already has a respiratory infection or a viral cold, preventing the spread from the infected person to non-infected persons. In doing so, you can place the mask over your face, and as long as you have it fitting snugly, if you cough or sneeze, it will stop those respiratory droplets. The other question that folks have been having is how about the use of the antiviral medication Tamiflu? We will reserve the use of Tamiflu only for those who are severely ill, and that being defined as someone sick enough to be in the hospital or any of those groups of people who are in the high risk for complications from the virus. And those include children under the age of 5, folks over the age of 65, people with serious chronic medical conditions like chronic lung disease, anyone who has a problem with your immune system, whether it's from active cancer or things like HIV infection, and finally, pregnant women. This medication is also used to treat other forms of the flu, but there is no indication for its use for just traveling, for example, to Mexico City. It's important to understand that the information from the WHO and the CDC says that this virus is sensitive to the two antivirals that we have available in the world, both zanamivir and oseltamivir, also known as Tamiflu. It's important to use this medication only when specifically indicated to prevent the opportunity for the virus to mutate and develop a resistance to these two important drugs.